we can use the bicycle or pedaling exercise where we move the baby's legs and we do the pedaling motion while gently pressing on the belly or applying equal pressure. The gas, God willing, will be released. Today, I will talk about the problem of colic in children. It's an issue that all mothers have faced. But for mothers who are new to motherhood, the problem feels much bigger for them because they don't have enough experience or knowledge yet. It can even affect them personally, They might experience depression. People might even blame them for not knowing what to do, how to deal with the baby. That you should know how to hold your baby properly. You don't know how to calm them down. You don't know how to feed them. But the problem isn't really with the mother. The problem is with the baby themselves. After the problem arises, or how to deal with it, keep watching the video until the end. Colic is a series of episodes of crying and screaming in children. The baby keeps crying and screaming a lot because of the pain they feel in their stomach during these episodes. The baby's face becomes puffy and red, their hands are clenched tightly, their legs are drawn up, and their knees are raised above their stomach. The stomach might be bloated or not. Whether you pick the baby up or put them down, they don't stop crying. They just keep crying. But the baby must meet certain criteria for us to be able to diagnose colic in children. There are specific conditions that need to be met. First, the episodes of crying last for more than 3 hours a day, not just a quarter of that amount. Crying for more than 3 hours a day, for more than 3 days a week. It doesn't have to be for more than a week, as long as it happens at the age when this issue can occur in children. And it happens from 2 weeks after birth up to 4 months of age. The third condition is that there shouldn't be any other reason causing the baby to cry. And this is very important. We need to know this because if another reason exists, then that's the real cause and you should see a doctor at that time. What are the other reasons that could make a baby cry? The baby might be hungry and hasn't finished feeding, needs a diaper change. The baby is wearing clothes that are too heavy. The baby is wearing clothes that are too light, has diaper rash. You need to check his fingers carefully. There might be a hair wrapped around them. We need to make sure no one has held him incorrectly. No one has shaken him too much. No one has pulled his arm. This could cause muscle tears. We need to check his temperature. We need to see if he has symptoms like vomiting or diarrhea. If there is blood or a rash on the body, diaper rash. There could be more serious things like if the foreskin is tight. If it's a boy, we need to check that. The testicle might be twisted or could be the cause, so we need to focus and check. Are there symptoms of urinary tract infection in children? Lethargy, frequent urination, a smell in the diaper or in the urine? If we've ruled out all these things and met the conditions, we can say that this child has colic. Is the mother the cause? Maybe she doesn't know how to breastfeed him properly. No, not at all. The reasons are actually unknown. We can't say for sure that this is the definite cause, but there are some theories that suggest air entering during breastfeeding. This is one of the reasons related to the way babies are fed, and it can cause colic in infants. But this is a minor cause and doesn't lead to the severe crying episodes we're talking about, and it's easy to treat. Another thing we say is that this is a developmental stage due to the intestines not being fully functional yet. So, for example, issues like colic, constipation, and diarrhea can be considered part of this period in children. This is one of the most important reasons. And there's a lot of talk about something called the bacterial fingerprint present in the intestines. This refers to the balance between the friendly bacteria inside the intestines. It leads to increased efficiency of the digestive system. All of this, or the bacterial system inside the gut, leads to problems, including colic problems in children. Of course, there are also interactions with other diseases like milk protein allergy and gastroesophageal reflux disease in children. But these are not just accompanied by episodes of screaming and crying. They're also joined by other symptoms. Milk protein allergy, more on this later. Acid reflux in children. We will also discuss it in a separate video. It's not just these symptoms and crying that occur together. Other symptoms will be covered in future videos. Research suggests premature birth or maternal smoking increases the risk. Symptoms of colic in children. Alright, so we've determined that the baby just has colic and no other issues. What should I do now, doctor? Should we run tests or do any analyses? There's no need for any tests or analyses. So what should we start with? The first thing is to look at simple things like the problem of gas that enters during feeding, and we try to reduce its causes by teaching the mother the correct way to breastfeed. We have already made a video about this before, and you can refer back to it if you wish. You will find it in the first comment on the video. One of the important things is that the mother should not feel pain during breastfeeding. If the mother feels pain, then the baby is not latching properly and air enters the digestive system, causing issues like colic and abdominal pain in infants. Of course, we also need to teach how to burp the baby. Burping should be done once in the middle of the feeding and once at the end, because she should place the baby on her own shoulder, and gently pat the baby. until we hear the burp. Then the baby can continue feeding, and after that, we repeat the burping process a second time after feeding. If there are any gases, they will come out, God willing, and the baby won't need anything more than that. The baby should finish the entire breast from the mother. He shouldn't just take the foremilk, because that increases gas a lot. He also needs to get the hind milk, which contains the full nutrition for the baby. Okay, doctor, we breastfed regularly and in the right way, and we burp the baby, but the baby still has gas and a bloated upper belly, so what do we do next? We do abdominal exercises for children, and there are many methods for this. We need to teach the mother 1 or 2 techniques to use, God willing. This will help reduce the gas a lot. I prefer the method of abdominal massage, where we take the baby, apply olive oil or something similar to his belly, and then massage the baby in a clockwise direction while keeping the belly steady. The gas, God willing, will start to come out of the baby. We can also massage the baby in a vertical motion. This also helps the gas to come out significantly, God willing. Personally, I prefer that we tell the mother. She crosses one leg over the other, places the baby's belly on her knee, and gently rocks the baby. She can get close to the baby and do the phone motion while massaging with olive oil in a clockwise direction on the baby's back. Foods that increase gas include cabbage, like coleslaw, and many others. It can cause constipation, so we try to reduce these foods during breastfeeding or in the first 4 months, as I often feel. You mentioned the importance of the mother avoiding them. Foods that contain cow's milk products also greatly reduce colic in children. Of course, there are studies with different opinions on this, but there is a very important point here, and this is the medicine I recommend, especially for babies who are breastfed, and it's the beneficial bacteria, specifically Rotary, which is a type of bacteria. The beneficial bacteria are found in a certain area. It's called BioGaia, and there are already studies on it, and it has proven to be highly effective in cases of colic in children, and it's available on the IARB website. If you'd like to buy it, we'll leave the link for you below in the comments. So I recommend using beneficial bacteria in cases of colic. It's a safe and good medicine. Of course, some special formulas have low lactose content and also have a lot of milk protein, and they reduce the incidence of colic to a certain extent. And it's the doctor who prescribes them. My message in this video is that colic in children is a developmental issue. So over time itself is the most important factor in its treatment. As time passes, the treatment becomes easier until the child reaches 4 months old. You should handle it yourself, and don't worry, because it's just a matter of time and it will go away. If you want to comment and benefit from the video, subscribe to the channel.